Well, U.S. President Joe Biden is planning on ending his country's COVID-19 emergency declarations on May 11th. Monday's announcement from the Biden administration comes nearly 3 years after the United States imposed sweeping pandemic measures to combat the virus. Biden has repeatedly extended the measures, allowing millions of Canadians to receive free tests, vaccines, and treatments. Now, once the declarations expire, those costs will be transferred to private insurance and government health plans. Well, following the decision by the World Health Organization to extend its global emergency declaration for COVID-19, there are new concerns. The world is dangerously unprepared for future pandemics. That's coming from a report by the International Red Cross calling on countries to urgently update their preparedness plans. But many are now wondering, after 3 years of COVID-19, how ready is Canada? Joining me to talk more about this, Dr. Marla Shapiro, CTV's medical contributor. Dr. Marla, always good to see you.
You too.
And that is sort of the million-dollar question. Yes. Is Canada prepared? Before we get there, though, I want to get your thoughts on this warning saying that the world is, quote, dangerously unprepared.
I think we are unprepared.
Yeah.
I think, we can look back at the lessons that we've learned, and then we can see what have we put in place. And, when we look at the perspective, we look at our perspective, where we are in Canada, what's happening in Canada. Many people feeling, oh, this is behind us. No masks, we don't need to worry about this. But we need to think about the global perspective in the past 7 or 8 weeks in terms of reported deaths, approaching close to 200,000, but probably more than that in terms of unreported. So COVID's not going anywhere quite yet.
And with that being said, then, of course, we have to look at here in Canada and sort of where we're standing, where things are at. The WHO has sort of lifted that emergency label, if you will, of the pandemic. Canada's still staying where it is, but if we were to hit by another pandemic, are we ready?
So we have to think about what have we learned and what can we put in place for future pandemics, because I don't think this is the last pandemic. And within my lifetime being a physician, I cannot think of another illness, event that completely impacted the world the way this has. And I don't think there's going backwards in terms of how we manage things. So what have we learned? The first thing we've learned is that what happens globally can happen in our backyard as well.
Right.
So the first thing, and I think the World Health Organization talks about this, is monitoring what we call zoonoses. So think about what happened in the wet market. Zoonoses means you're looking at a pathogen, a virus that happens in an animal and then makes the leap to a human. So if we don't monitor that and have an alarm very quickly, as we did, that something is happening here, at the beginning people thought, oh, this is just another flu. Wasn't just another flu.
Yeah.
The second thing is to continue to do this sequencing globally that we do. So that means understanding the DNA of the virus that we're seeing. That's why, for example, we could know in Canada that we had this new hybrid in terms of 2 Omicrons that had gotten together, the so-called Kraken that we're looking at now. Keeps us ready to know what we should be doing next. The next is to strengthen manufacturing. So we look in Canada, are we ready in terms of manufacturing? And that includes things like, for example, personal protective, PPE, masking, gloving. Are we still depending on an import chain? Preparing for vaccines rapid production. In Canada, if something was to happen right now, we still don't have plants that are up and ready to make these vaccines. We've had announcements about, for example, Moderna developing a plant in Quebec, not ready to go, maybe for 2024 if we're lucky. And actually making sure that we can deploy the vaccines, not only here in Canada, but around the world, because vaccine inequity means that we leave ourselves at risk. And then finally, something that nobody really wants to admit, it's the notion of stopping the spread. That perhaps when we look retrospectively back, Angie, at what we did, we masked too late. We social distanced too late. There was mixed messaging about the fact that masking could make a difference. So if we have a new pandemic that's developing while we're sequencing, while we're up-ramping vaccines, trying to distribute them globally, to remember that we do have techniques, mitigation strategies in place that we've learned about and we understand. So we're not masking as much now, although the World Health Organization says mask on a long flight. These are the lessons that we've learned. The question is, are we prepared to act?
And before I let you go, I've got a few seconds left here. What about the messaging then that comes with all of that? Because that we've had that back and forth.
Right. So hopefully we've learned that having a unified message that is transparent, easy to understand, quick to communicate without the confusion that we saw, masks on, masks off, does it help, does it not help, all of those things, the supply of the vaccine so that it's easy. Remember at the beginning what it was like to get a vaccine? We want to move forward and be prepared for what might be down the pike.
A lot to keep in mind indeed. And of course, we want to remind our viewers that all of this information can be found on our website, ctvnews.ca. Dr. Marla, always good to have you in studio to talk about this. Dr. Marla Shapiro, CTV News medical contributor. Thank you for this.